Hey everybody, this is Brett, and today I'm going to show you how to get rid of a pain that you might have on the back of your knee. And I noticed this morning when I got up that I had one of these, and so I was like, well, I know what to do about that. Whenever you have a pain on the back of your knee here, it's because either these are tight or these are tight. Or probably both, because they're connected to each other. And so what you need to do is take your hands and start feeling. Feel for where it's tight. Okay, so these are your soleus muscles. And these lower leg, back of the leg muscles are split into two sides. Okay, so here is the gastrocnemius muscle, and as you can see, it is kind of split into two sides, but that's all one muscle. And then this is the soleus muscle. It's actually not really split into two sides like the gastrocnemius muscle. In other diagrams I've seen it is more. But in any case, you can see how the hamstring muscles are interconnected with these lower leg muscles. See how they overlap here? And right in here is where those tendons connect to the bone. Both these and these are connecting in and around the back of your knee to the bone. When all of this big muscle belly area gets tight, it puts strain on these. You can also massage directly on the tendons back here, but you want to focus mostly on wherever it's sore, massaging those muscles. Okay? Okay, so this shows your hamstring muscles, your posterior thigh muscles. And it also shows your gluteus maximus here. And this side shows your external muscles, your superficial muscles, the ones on the outside, and this side shows your deep muscles underneath those. There's two layers. Okay, so your gluteus maximus muscle here, and there's actually two more gluteal muscles in addition to that one that aren't shown on this. Your ischial tuberosity, which is a bone here. Adductor mangus muscle here. Number 2 is your semimembranosus muscle, which is here, deeper, and here it shows it a little bit there underneath this muscle here, which is your number 1 tendinosus. Semitendinosus is this muscle here. And then that would be where that is right there, connected to the ischial tuberosity. Remember, this is your deeper muscles and this is your superficial. Number 3 is this muscle under here, underneath here, the biceps femoris muscle. And number 4, this muscle here, is your biceps femoris long head muscle. And you have to dig the shit out, whether it be these muscles or some other part of your body. The basic rule is no pain, no gain. You have to get in there to release these so that the tendons here do not get strained when you go like that. If you don't do this and you continue to walk, these get more and more strained and injured, and pretty soon you have to use crutches because you didn't take care of the problem in the first place. So after you have really worked these out, you've really massaged them deeply, then you go back here and you do the same thing. I'm going to use both hands here so I can kind of get in there better. And these are harder to work because they're big. For me, luckily this morning, it's not these so much that are the problem. It's these. Okay. Okay, so another thing that you can do to work on the back of the hamstring muscles is you can find yourself an edge of a table like this, and you can take your leg and put it on there and kind of work it like that. If you put some oil on the back of your leg, then it'll slide and then you can really work it deeper. Okay, and then after you've done all that, then you may, if it's not too sore back there, the tendon's not too sore, you may be able to gently stretch the calf like that. But remember, you've got to be careful to not injure the tendon, so feel it, and don't go beyond what you can do. Then you can touch your toes, once again being careful to stretch all those back of the leg muscles like this. And just hang there. Okay, so there you go. That's how you do it. That's how you get rid of the back of the knee pain.